First, I'm going to start with a video explaining what is tuberculosis.
The signs and symptoms should see is an infection of the lungs caused by the bacteria named Mycobacterium tuberculosis. It is a contagious bacterial infection that begins in the lungs and can rapidly pass to any organ of the body, often affecting the kidneys, the bones, and the brain, traveling via the lymph nodes and bloodstream. Tuberculosis, which you will see abbreviated as TB, is known to be one of the oldest diseases among humans, and today is one of the leading causes of infection and death in adults. According to the World Health Organization, about 1/3 of the world's population is suffering from this disease at present, even though there is a live attenuated vaccine, BCG, which stimulates the body's immune response against the organism. There is still a high morbidity rate in some countries every year. Africa, Western Pacific, and Southeast Asia are the most affected areas, making up about 86% of all tuberculosis cases in the world. TB is highly contagious. It can spread from an infected person to a healthy person through the air by inhaling airborne droplet nuclei of the infected person. These airborne particles come from the infected person through sneezing, coughing, laughing, and other forced respiratory acts, which is why someone close to an infected person on a daily basis will be at higher risk of getting infected, especially, for example, if they share the same room. If the droplets containing M. tuberculosis bacilli are large, they become embedded in the proximal airways, which do not cause any infection. The infection happens when the particles are small, enough to cross the upper respiratory defense and reach the lungs, where they are planted in the subpleural spaces of the lower and middle lobes, and then spread through the lungs. Once TB was a widespread infection, but in the 1950s, several antibiotics were developed, which helped eliminate the disease in many countries. However, some years later, new forms of the bacteria are emerging, which are resistant to the antibiotics, which means the treatment drugs have no effect on them. These new forms of bacteria, such as extensively drug-resistant TB and multi-drug-resistant TB, are more dangerous and have affected many large cities of the world. Whether the active or latent form of TB infection, anyone with TB signs and symptoms should seek medical treatment as soon as it is discovered. Risk factors.
The second video explains how the body reacts to tuberculosis.
An estimated 1/3 of the world's population is infected with tuberculosis. 1/3. And here's the culprit, the minuscule bacterium called Mycobacterium tuberculosis. But does that mean 2.3 billion people are sick? Fortunately not. Only a small proportion of them actually become sick. To understand why, let's take a closer look at the bacterium itself. When someone with TB coughs, they expel little drops of saliva that fly into the air. Some of them may contain the TB mycobacteria, which can then be inhaled by someone close by. The mycobacteria then continue their journey down the respiratory tract and into the lungs. That person is then infected with TB. And this is where it all becomes a little more complicated. The body detects the invasion and sends out its first line of defense. This includes special cells called macrophages, which engulf the mycobacteria and transport them to the lymph nodes, where they are neutralized. If they're neutralized, the person will have what is called latent tuberculosis. This means they're infected with the bacterium, but they don't have active TB disease, and they're not sick. However, in 5% of cases, the immune system is overwhelmed. The TB mycobacteria multiply and escape, and the person falls ill. This often happens with young children, whose immune systems are not fully developed. In other cases, latent TB can wake up and become active TB. This can happen months later, or even years later, especially in adults with weak immune systems. For example, people who are HIV positive, or who've had organ transplants, or who are undergoing chemotherapy. Once in the lungs, the bacteria may spread via the bloodstream or the lymphatic system to other parts of the body, to the lymph nodes, bones and joints, the digestive system, the central nervous system, the liver, or the heart. So what happens when someone has active TB? Let's imagine the infection's in the lungs, as this is the most commonplace. The patient starts coughing, has difficulty breathing, and suffers from chest pains. If these symptoms last for more than a few weeks, and are accompanied by fever, night sweats, and weight loss, the doctor has good reason to suspect tuberculosis. The next stage is diagnosis, and then treatment. The battle is far from over.
What is a tuberculous abscess? A tuberculous abscess results from the disintegration and liquefaction of tuberculous granulation tissue which has undergone cassation. Fluid and cells from the adjacent blood vessels exude into the cavity and lead to variation in the character of its contents. In some cases, the content consists of a clear amber colored fluid in which are suspended fragments of scissated tissue, in others of a white material like cream cheese. From the addition of a sufficient number of leukocytes, the content may resemble the pus of an ordinary abscess. Cold abscess can be diagnosed by ultrasonography or MRI or CT. Such abscess should be drained or aspirated. This video shows us how a abscess can be drained.
Hi friends, here this is the thigh region of the candidate, and there was a quite big swelling was present over there. It was a firm inconsistency, and When aspirated, we found a pus over there, but there were no signs of any inflammation. And so such kind of abscess is known as cold abscess, where the signs of inflammation are absent. And if painful can be due to the pressure when the abscess and the pus exert the pressure on the surrounding area. So such abscesses are usually seen with the tuberculosis. You can make the diagnosis under ultrasonography as well as CT scan, and MRI is also advantageous. So sometimes they are associated with psoas abscess. They should be aspirated with anti-gravity technique so that a sinus may not be formed. And in the case of psoas abscess, etc., a CT guided aspiration should be done. While if sometimes it is forming again and again in spite of many times of aspiration, so you need to give incision and drainage. So and the pus that collected must be sent for the culture on sensitivity, and after that a proper antibiotic therapy should be given. And since it is that the tuberculosis, the anti-tubercular drugs should be prescribed as well. And about 300 ml of the pus was aspirated out of a huge cavity formed over there. Thank you for giving your valuable time.
Application in nursing. Patients with tuberculosis should be monitored regularly to ensure that no interruptions occur in treatment. Serious side effects from the treatment are quickly identified. There is improvement in the patient's condition, although this is often very gradual. Home visits are the best way of making a holistic assessment of the patient's needs and progress. Patients often need help to deal with these more immediate difficulties before they will consider taking anti-TB medication and attending hospital appointments. The nurse's role is vital in the control of TB and for the successful completion of the patient's therapy. Once a diagnosis has been made, the patient needs to be established on the correct treatment. Many patients find the treatment course difficult at the start because they have to take numerous tablets, some of which are very long and have various side effects. Later, when symptoms have resolved but the patient still has the disease, they may question the need for continued treatment. TB nurse specialists can ensure that patients are given the correct medication and can provide support for patients and their relatives or carers to prevent lapses in treatment. The TB nurse specialist can help to manage side effects or drugs formulation, take routine blood samples, or occasionally arrange admissions to hospital. Pros and cons. A tuberculous abscess arising from a tuberculous costal cartilage was successfully treated by aspiration of the contents of the abscess cavity and immediate injection of streptomycin into the cavity. But as far as we know, no other such case has been reported in medical literature. Issue applied in Ecuador. Incidence of tuberculosis per 100,000 people in Ecuador was last measured at 59 in 2012, according to the World Bank. Incidence of tuberculosis is the estimated number of new pulmonary smear positive and extrapulmonary tuberculosis cases. A tuberculous abscess may in one or another of these ways be a cause of death, so it needs to be well treated.